Hi moms and dads, and a warm welcome to another episode of Today's Parent, where we connect with experts and provide you with information to make your parenting journey a bit more easier. I'm your host, Christine Casina. In today's episode, we are talking about mental illness in kids. It's something that parents need to understand, and it's very hard for a lot of us as parents to identify in case our child has a mental disorder. In studio today, we have Rosa Sanau. She's a counseling psychologist, and she's going to empower us on matters mental illness when it comes to children. Welcome to the show. Rosa, it's a pleasure to have you.
Thank you, Christine.
Really nice to have you today on the show. And let's start from the very beginning. Mental illness, especially in children. How do you define that?
Well, I think the definition is just in mental illness itself, because what we are given as a definition of mental illness is when one is not able to reach their potential, contribute to society, and functioning in their day-to-day lives. So in children, it's still the same thing, that when a child is not able to achieve their milestones, their developmental milestones,
right,
when they are unable to contribute, even as a child, whatever contribution in their area of influence, and they are unable to function in their day-to-day lives.
Okay.
So simply, that's just how I can make it simple.
I'm wondering, what are the mental developmental milestones that occur in children?
So when we talk about mental illness in children, what we are looking at is in comparison to typical children. Because with typical children, we will say that from 0 to 2 years, children will have developed language, they will have developed the motor sensory skills, that is walking, crawling, sitting.
Right.
So those are the main milestones. So when we're looking at a child who may be having either developmental challenge, is that they may not be meeting these milestones like a typical child.
Right.
So we do not want to call them abnormal and normal children.
Mm-hmm.
I am using the word typical, not normal. Because if I say normal, it means those who are delaying are abnormal, which is derogatory.
Right.
Yeah.
For a parent who's listening right now, the word mental, even the word mental,
I know,
evokes certain emotions. So when you talk about mental illness in children, what are the common types of mental illnesses in children?
Well, there are quite a number, but I will group them so that it's a bit easier. Now, we have neurodevelopmental disorders. These are things that are either neurological formed or that have more of a genetic cause. So we'll be talking of things like intellectual disability. Then we can look at speech and language formation difficulties.
All right, even before you go fast, let's talk at intellectual disability.
Okay.
What does that mean? Break it down for us.
So intellectual disability is where you find that a child's, let me say IQ or intellectual capacities are not, again, as a typical child. Why I say that is because, for example, with the testing, we'll use something we call a WISC test, where a series of questions, you find that when a child is given, this child is unable to probably comprehend. Either their reading is a bit slower, things like dyslexia. Dyslexia now is being unable to read without an intellectual impairment. But for intellectual impairment, they may have issues with math, with reading, and with basic comprehension of say, terms that a typical child their age may be able to understand.
All right. So that's intellectual disability. Right. Okay.
So that is neurodevelopmental. Then we have those disorders that fall under social anxiety disorders or language development. There is speech disorder where a child is unable to develop speech in comparison again to a typical child. So you'll say at 2 years, a child probably is constructing a 2-word sentence or a 3-word sentence, but this particular child may be nonverbal, or they may be making squeaking sounds, or they're just like ooh, bubbling sounds.
Right.
So you find that they are either in their speech, they are acting like a 6-month-old, but they are 2 years. So those are some of the speech disorders. We also have the category of behavioral and emotional disorders. Now, behavioral is where you find hyperactivity, and I know that is highly misdiagnosed. I'd like to just put a caveat there, that just because a child is jumping around doesn't mean they are hyperactive. because again, a child's nature is to jump around. We need them to play.
Is hyperactive the same as ADHD, attention deficit disorder?
Hyperactive is a symptom, because in ADHD we look at inattentiveness and hyperactivity.
Right.
So it's just like a peak in the whole sea. Yes. So the emotional problems, behavioral problems, we are talking about things like oppositional defiant behavior.
Oppositional defiant
Behavior. So let me just make it very simple. This is where people think the child is either arrogant or rude, where the child is having problems with authority, especially in teenagehood, and 3 to 5 years where they're beginning to learn rules, they're beginning to learn social etiquette.
Right.
And you find that people say, oh, that child, her child is blah, blah, blah.
Yes, Kiangi.
Exactly. Or the child is just pure arrogant. This child doesn't understand rules.
Right.
So sometimes it's that kind of behavior. You could be having those that probably with emotional have bipolar or depression.
Okay.
Then the last one is eating disorders. That also falls under a category of mental disorders, anorexia, bulimia.
Right.
More common in teenagers, more than little children.
Right.
Yeah.
Are there factors that make it easier for certain kids to be predisposed to mental illnesses?
Yes. So one is genetic factors. If it's either run in the family, there are those that are hereditary. Then
Like which one?
Down syndrome.
It's hereditary. I thought it's a chromosomal. happens-
Depending on the genetic formation, because now it's the parents who.
Ah, right.
Yes. And when you look at, there are those, depending on the genetic formation of the parents. So when the ovum is being formed and all that, so that is a risk factor. Number two is parental health, mental and physical. So if a parent was smoking, drinking while she was pregnant, she's likely to predispose her child to some mental disorders. And if the parent was also depressed, if the parent had depression, not depressed, but if the parent had depression or any other mental illness, then environmental factors, like probably...
So depression can be passed on?
Yes and no. Yes, because depression also does not have just one cause.
Right.
So there is genetic predisposition, and then now there is environmental and psychosocial factors. So where there is a genetic predisposition, now that can be passed on. Again, the other way it can be passed on is because of behavior. You see, if when I bring a child to this world and even my emotions, I am passing them on to the child. So if my general affect and mood is sad and cranky, and when I am breastfeeding the child, when I am talking to the child, that's all I do, the child learns. Because children just learn by observation and relation.
So that's energy is passed on to the child.
Exactly. So that's just how we say it's passed on.
Right.
Yeah.
Right.
So psychosocial factors, poverty does sometimes also is a risk factor.
Really?
Yes.
In what way?
Either in ways, let's say nutrition, where parents do not provide the right nutrition, where there was in areas, let me say dump site. I don't want to call them dump sites,
right.
But there are areas that you find either chemicals have been released into the air, people who live close to factories, these chemicals that either the parents inhale before they even conceive, or just the general population.
Okay.
You find that there are those chemicals that are found to affect the brain development, or the transmitters, the chemical transmitters in the brain.
Okay.
Yeah.
All right. So what are the common symptoms of mental illnesses in children?
Depending on the illness or depending on the disorder. But what we say is let your child be diagnosed. Don't self-diagnose. One is if the child is not meeting the typical developmental tasks, don't panic, don't freak out. It's probably just delay. But where you feel that you are worried, just go and get diagnosed. Don't just see my child is hyperactive, oh, my child has ADHD.
Right.
Or someone comes and tells you, your child is not yet sitting, this child must be having autism. So some of the, can I mention a name of an institution that does that very well? The Kenya Institute of Special Education, where you feel that you are worried about anything concerning mental illness. They take the child through a series of tests
Right.
and diagnosis depending on the behavior presented. Because you see, like autism will present social deficient disorders. They may be unable to carry conversation. Hyperactivity may present different symptoms. So intellectual may present slowness to read, slowness to write, you see. So once you are taken through the specific test, and when a psychiatrist or a psychologist is observing, they are able now to tick from the tool.
Yeah.
I wouldn't even just observe and say, you look like
You have ADHD.
No. I highly disregard that, because it tends to reduce these children and make them, because you're just passing judgment because of a facial or because of how they're acting, without making a conclusive. And some of these activities or some of these symptoms are outgrown. So you see, if I meet a child just now in 3 minutes interaction, then I pass judgment to the parent and say, your child has autism, or your child has bipolar, I am already creating panic in this parent. And I am not aware either, what is the current family situation? Have they undergone a loss that is making this child act out?
Right.
Yes.
You know, Rosa, what I'm wondering is, as a parent, even for a parent who's watching, the line is so thin between a delay and this being an actual problem. So how do you differentiate the two? If this is something that, like you say, a child is going to outgrow, probably at this point we can talk about the warning signs that parents need to look out for when it comes to mental illnesses in children.
So one of the things that I'd say with observation, say if a child is not making eye contact by 6 months, probably.
Right.
You see, small things like that. If they are not sitting by, say, 4 to 6 months.
But if they're not sitting between 4 to 6 months, is this a mental or developmental issue?
It could be either or. So,
so just to rule out
that out, just go see your practitioner, who may send you to a psychiatrist for diagnosis. Because what we want is to promote early detection, and also to just reduce panic. Because you see, I'll panic and I'll just stay with my child in the house saying, oh, my child is just unwell, my child has a mental illness. But if I rule that out, I probably know it's either developmental or it's just a delay that they'll outgrow. So when I notice that they are not meeting their developmental tasks,
right,
I can go get checked. The same way you go for your vaccines. You don't really panic. You just go for your vaccine and say,
it's a normal thing for me to do as a parent.
Exactly.
Social phobia. Is it related to any mental illness when it comes to children? Your kids who are just, they do not want to be around people? Or is it something that eventually, is it something that a parent needs to worry about? That at some point, there's the usual stranger beware.
Anxiety.
Yes, but
stranger
there's
anxiety.
A child totally cannot be around people. They want to be alone in their own corner, do their own thing, rock back and forth.
So stranger anxiety is normal, like you're saying, but social phobia, social anxiety there's actually just a disorder called social anxiety disorder,
right,
where individuals are unable to maintain social interactions. They find it very awkward to even initiate a two-way conversation. It's a whole task for them to have conversation and maintain relationships.
Right.
So with social phobias, we will be looking at, is this person able to maintain conversation? There are those phobias in teenagehood that are normal. Because teenagers are struggling with identity, there is a normal level of wanting to be alone as they discover. It's like a larvae coming into a butterfly. It just needs that time.
Yeah.
Don't try and, when a chick is coming out of the egg, don't try and help the egg break. Give it time. Yeah.
All right, we're going to take a short break and then we'll hear more from you when we are back from the break.
Thank you, Christine.
In studio today, we have Rosa Sanau, and we are talking about mental illness in children. I hope so far you have learned something. When we come back from the break, Rosa is going to take us through management and treatment and what you need to do when it comes to mental illness in our children. Don't go anywhere. Welcome back to today's episode of Today's Parent, where we are talking to Rosa Sanau. She's a counseling psychologist and she's taking us through mental illness in our children for us to understand better and see what we can do if it's something that is afflicting our children. Welcome back to the show. Rosa, as we're coming back from the break, we have a question from Francis. And Francis's question is, does schizophrenia happen in small children or children in general?
So yes, it does. And the term used is childhood onset schizophrenia that has some of the symptoms of schizophrenia that we know in adult. Now, one thing that we didn't mention before the break was diagnosis, which the tool that we use is called DSM, so a Diagnostic Statistical Manual that is accepted across the globe. So that is why I was highly recommending that parents avoid self-diagnosis.
Right.
Because now with that tool, they give clear criteria where it's just not one symptom. So like in schizophrenia DSM, the Diagnostic Statistical Manual, it gives hallucination, speaking words or speech that cannot be understood.
All right.
And unusual behavior. So some of these symptoms, when we are diagnosing, yes, a child can have, but we will not just pick one symptom. It has to be 5 to 6 symptoms occurring before the onset of maybe below 12 years, and it has to be affecting their daily life, and it has to have occurred probably within a certain period of time. There are some disorders that are given a period of 1 year, that they have to have been frequent and not as a result of trauma, but it has been repeated just in a normal activity and repeated at home, work, and any other environment the child is in. Yeah.
Okay. The diagnosis process, how does it look like?
So diagnosis process, once you come to either a psychologist or a psychiatrist.
So a parent needs to see a psychologist or a psychiatrist.
Yes.
There's a place you mentioned in before we went on the break that a parent can go for a diagnosis as well.
Yes, diagnosis at the Kenya Institute of Special Education.
Kenya Institute of Special
Education
right.
in Kasarani.
Okay.
It's a government facility, so even assessment is free.
Is it?
Yes, it is free. You just book, and now the facility is actually expanded, so it's just walk-in. You just walk in right now and you get assessed. So when you walk in, you get qualified psychiatrists, qualified psychologists who have specific assessment tools. So the
Did
process,
you say it's free?
Yes, it is.
I think most people are not aware of that.
You know, and it's easy. It takes less than maybe 3 hours, or it's not as lengthy as someone would imagine.
Okay.
So you walk in, you go through assessment. Assessment looks like, one, a child may be given simple tasks to do. So say if it's a 3-year-old child, they'll just be put in a room like this to play with toys. So as the professional is assessing their play will tell you what is this child going through.
Okay.
Older kids may be given tests to fill in. There is interview taking. So I'll just say to the child and ask something like, I have a dog that I have locked in the room. If I want to take the dog out, what do I do? A typical child will tell me, we'll open the door. But probably a child with a mental disorder, depending on what disorder it is, may start thinking about, why is the dog in the room?
But that's a logical question, isn't it?
It is logical, but for a child that age, they may just be thinking, we will need to get the dog out.
I'm thinking this child is a genius, but go ahead.
Yes, so interview taking, things like that, assessment tools, and then there are those that may go for physical checks to rule out any physical ailments.
Right.
Yes, so that is how assessment looks like. And one of the things that we insist on is history taking. History taking is, I want to find out from the parent, how are you before you conceive this child? Did you have any prenatal or postnatal complications, either at delivery? Because one of the things that also happens is when a child is being delivered, any birth complication, either before, during, or after birth defects, can cause mental illness. Something like maybe a cord wrapping around the child's neck and enough oxygen does not get to the brain may cause the child to have cerebral palsy or have any other, because if oxygen is not supplied to the brain, then it affects the brain development or something like that. So history taking is very, very important. I need to know even what is the current condition at home. is the child or the parent going through current stressors or traumas that may either be causing this condition to be very severe or making it impossible to manage. I need to know the history of the family in terms of, have you had mental illnesses in the family? So the diagnosis is a spectrum. It's not just one thing like a lab test. I'll say, bring your blood, I check for malaria, or I check for, no. So we do all those interviews, assessment tools, history taking, play, just to observe and know what could this child be going through.
Okay. Okay. What are the treatment options?
Treatment options are a couple. Number one, counseling, psychotherapy, because psychotherapy may include play therapy for children. Like I said before, there are conditions that children will outgrow. So as children play, they therapize themselves, because the nature of play is to help the unconscious of children come out and helping them release anxiety.
Okay.
So as children play, as they interact with art, as they interact with music, some of these things, it just lessens their anxiety. So that is a management option. Behavior therapy, where we teach children coping skills. So a child cannot probably read properly, but what other strength? That is also something to encourage parents. If your child has mental illness, what other strength does this child have, other than the fact that they can't interact socially with people, which also can be learned? Because another thing we discourage is saying something like an autistic child. Because when I say an autistic child, I am meaning the entire being of this child is reduced to autism. But this child can actually exist and they have other things that do not center along.
Beyond the condition.
Yes, beyond the condition. So when I say a dyslexic child, I am meaning that all that defines this child is dyslexia. But when we are looking at treatment in like behavior therapy, we want to look at what strengths. Then we amplify this strength. If this child is good in art, we want to amplify this strength so that this child can build esteem,
right.
They can build confidence. Another technique is family counseling, where we bring in the support system of this child. One, to create awareness, to improve management techniques, to deal with the trauma, and to deal just with the fact that this is not something we expected. But how can we continue loving this child and even loving ourselves? And be bold and not be ashamed. The other thing, not to be ashamed of this condition. So that is family counseling. Medication is also another intervention, because some of these illnesses you find that it's either a chemical imbalance in the brain. So sometimes children are put on hormones or things like maybe dopamine that helps to stabilize, especially with mood disorders and hyperactivity. So it either helps the child sit still in class or be able to be attentive or manage the moods. So it's a spectrum. Again, no intervention works independently. So sometimes you just need to say, you know what, I feel like I want to give up, but someone just tells you, hang in there. Yeah.
All right. Your final word of encouragement to a parent watching out there?
That your child is okay. There is no definition of normal, because we just say it's typical. So what if your child has delayed their milestones, or that your child has been diagnosed and you have confirmed that it's a mental illness? Your child is beyond their mental illness. A human being has 15 plus billion neurons in their brains. They can develop and grow into exceptional things other than what we have defined with our DSM manuals. Number two is breathe. Allow yourself to just be as a parent. It's okay to not be okay. It's okay to feel like you are sad. It's not what you maybe have expected, because compassion fatigue is something that is very real with parents. You take care of a person to a point that you acquire trauma, secondary trauma, because of taking care of someone else. So allow yourself to breathe, take care of yourself, and understand that your child is beyond. I think that's the tagline. Your child is beyond whatever illness, and support your child, because they may be the next Albert Einstein, who knows.
Thank you, Rosa, for coming to share.
You're welcome.
On
Thank you, Christine,
on
for
that
having
wonderful
me.
note, we end the show, and we thank you for your time.
Thank you.
Thank you, Rosa. And with that, we come to the end of today's episode of Today's Parent, where we were talking about mental illness when it comes to children. Rosa Sanau, a counseling psychologist, has been able to break it down for us, and I hope now you have a better understanding. If you have any questions, please pass them on. Send them to our SMS number, And we'll get Rosa to get back to you. If you need any kind of support as well, please also reach out. And remember one thing that Rosa has emphasized on. Your child is uniquely what they are, and they're not defined by their condition. Love them regardless. Thank you for watching today's show. I have been your host, Christine Casina. We are here in studio at Little Cribs, the home of fun, exciting and durable kids furniture. If you're looking for parenting resources, go to www.supermamas.co.ke. And with that, we come to the end of today's show. We look forward to having you next time.